You've just seen the American Heart Association's new public service announcement regarding the changes in CPR. CPR is so important. You can learn this life-saving skill at Nature Coast EMS, and it truly does make a difference. If you're interested in learning, just give us a call at 249-4770 or look us up on the web at naturecoastems.org. We have all different levels of training available. Some you can take online and come in just do the certification, or we have formal classes if that's what works best for you. So after these messages, we'll be back with our next guest, paramedic Brian Bentley from Nature Coast EMS.
Just as our nation's military corpsmen render aid to wounded soldiers on the front lines of battle, Nature Coast EMS paramedics and EMTs also offer life-saving aid far from a hospital or medical facility. Not-for-profit Nature Coast EMS paramedic crews are serving healthcare's front lines throughout Citrus County, working with firefighters and Citrus County's air medical services to make a life-saving difference.
Welcome back to Every Minute Counts. We're here with our special guest, Brian Bentley, and Brian is a paramedic with Nature Coast EMS. But not only is Brian a paramedic with Nature Coast EMS, he's also our EMT instructor and has done a phenomenal job with teaching EMTs and a lot of the public on a lot of different things and ways they can save a life by learning life-saving skills. We're going to talk a little bit about sleep apnea and overdoses that can lead to respiratory arrest issues. But first, let's talk a little bit on sleep apnea. Now, in our previous segment, we talked about SIDS. SIDS and sleep apnea are actually two different things, and typically sleep apnea affects adults. So as we begin this conversation on sleep apnea, just ask Brian, can you describe exactly what is sleep apnea?
Sleep apnea, there's a lot of predisposing factors to have sleep apnea. One of the biggest ones is actually being obese, being overweight, and also high blood pressure. And it's caused from the relaxation of muscles back into the back of the throat when you go ahead and sleep. And a lot of people think that whoever snores suffers from sleep apnea, and that's not necessarily true. There are a lot of predisposing factors, like I said, hypertension, with high blood pressure, and also being obese, and it's also positioning how you sleep as well.
So what are the symptoms of sleep apnea?
Well, as far as the symptoms, restlessness, as far as not being able to sleep at night, one of the big things is having the person that you sleep with, your partner, your wife, kind of not recognize that you're not breathing at night or not breathing normally at night. A lot of people snore and then there's a pause for a certain amount of time, and that's what sleep apnea is. Apnea means not breathing for a certain amount of time.
So how can you tell if you have sleep apnea or not? How do you get diagnosed with this?
Well, like you said before, a lot of the symptoms, kind of being tired during the day because you're not getting sleep, you're constantly getting woken up from starving of oxygen, so your body naturally wakes you up and then you go back to sleep. Well, then you don't get what's called the REM sleep. You don't get down to that deep sleep. And without REM sleep, you actually, don't get sleep per se. So, you would go ahead and get a sleep study done, which they observe you sleeping, and they go ahead and monitor your respiratory rate and your respiratory function, and then you get diagnosed with sleep apnea, maybe.
So how do they treat sleep apnea?
Well, there's two different treatments. One treatment is surgery. They go ahead and remove the excess tissue in the back of the throat that causes the close off of that, or they use what's called CPAP. CPAP, continuous positive airway pressure. And what that is continuously forcing a certain amount of air into the back of your throat, keeping that space open. And when they do that, it continuously puts that pressure in there, you could breathe freely back in the back of your throat. And it is very, very effective. You know, it just takes a little while for somebody to get used to that mask on their face and sleep with it. And it usually works out pretty well.
So what are the risks if you don't get treated for this, if you do have sleep apnea?
The risks are actually there has been death associated with sleep apnea through a certain amount of time, and your body starves to a certain point, and then it can't react, cannot wake up to the starvation of oxygen in the body. And you know, there have been a few cases of that, but you know, the thing that you need to do is recognize it. You need to, you know, actually recognize that you have some type of problem because you're not getting enough sleep. You don't have the energy that you have, and sometimes that happens.
Well, it sounds like it's very treatable. I mean,
very treatable. You know, both surgery and continuous positive area pressure, or CPAP, works out extremely well, and people notice a ton of difference in their lifestyle. They notice they have more energy throughout the day because they are sleeping in that deep sleep.
Well, thanks, Brian. And I've asked Brian to stay on and talk about how overdosing on street drugs or prescription drugs can sometimes lead to respiratory emergencies, and what some of the dangers are, and how we actually would treat somebody that might have that condition. So we'll be right back after these messages.
We were supposed to have coffee, and I found him like this.
Sir, can you hear me?
Is he a relative?
He's my brother.
Is he allergic to anything?
I don't think so.
I've got a weak pulse.
Is he taking any medication?
I don't know. I don't know. He's got this medical card thing, whatever it is, on his keychain.
That's what we need. Let me see it.
The invisible bracelet. It speaks for you when you can't. Electronic health information powered by the American Ambulance Association.
Welcome back. We're here talking with Brian Bentley from Nature Coast EMS about some of the signs and symptoms of overdosing and some of the respiratory issues that can be apprised of that. So Brian, what are some of the signs and symptoms of somebody overdosing?
Well, you know, first thing is their mental status. You know, it depends on what kind of drug you're overdosing on. You know, their mental status, or the way how they normally react. You know, the changes in that. That's what you recognize first. And also with any overdose, you know, nausea and vomiting is a very, very common symptom of any kind of overdose. So
what should somebody have this situation? What should they do?
Well, the first thing is call for help. That's the first thing that you do, because this person needs to be seen in the emergency room. Because there are so-called antidotes, but what they do is they go ahead and take care of the actual medicine itself. And also there are procedures that the emergency room can do to make sure that that medicine does not get absorbed in the body as quick.
Well, for years and years and years, we used to always talk about, we used to always give Epicac. Is that still a treatment that's done today?
That's actually not a treatment that's done very often today. Maybe somewhere in outerlying cities and so forth, that's still used, and it's still sold at Walgreens and CVS and so forth. But that's usually for you know, substances that have no harm coming back up. But that has gone to the wayside, and there are other things that we do besides that.
Right, and then I guess the danger when somebody has it is they can stop breathing, and obviously what can you do to help with that?
Absolutely. You know, as paramedics, we go ahead and arrive on scene and evaluate the person's, you know, respiratory status, how well they're breathing. And we were asking about the signs. You know, we look at pupils, we look at the history and the information that we get and determine what's causing this. But the biggest thing is your airway. If you don't have a clear airway, you know, you won't be able to breathe. And some people overdose to a certain point that their mental status is suppressed so far that it's just basically positioning how they are. So if you come upon a person that basically, you know, is unresponsive or not responsive, make sure they have a clear airway by opening up the airway a little bit, just tilting their head back so it has a clear way of getting the air into the body.
And call 911 to get help. Obviously, get help coming on the way.
Absolutely.
Well, thanks, Brian, for sharing that great advice on what to do on some of the signs and symptoms. And thanks to all our guests. Thanks to Brian for being here, and thanks to Bunny Hamer and Roy Bagley from the Florida SIDS Alliance for their input. And Thank you for watching this episode of Every Minute Counts. We'd like to thank our sponsor, Easy Living Furniture, for sponsoring our set. And we'd like to thank our board of directors of Nature Coast EMS and Bouchard Insurance and our team members and the Explorers and our Citizens Academy members and the alumni. So we'll see you next week.